I'm Dr Becky Appleton, a researcher in the Division of Psychiatry at UCL, and I'm going to be talking to you today about how to choose a research topic and how to write a good research question. When choosing a research topic, here are 4 interlinked strategies that you can use to help you choose a topic for research. It can be helpful to think about your local context. Is there anything you think works well or perhaps isn't working too well at the moment in your current role that could be improved if you could find out a bit more about the problem and some potential solutions? You could also scope the existing literature, so to see what research has already been conducted in this area, to try and address the problem and see if you can build on these topics when conducting your own research project. There might be some similar projects which have been undertaken at a local or national level that you could adapt to make it fit your specific role, your particular participant group, or your context. You can be creative, for example, adapting an existing model which has been developed for a different population to fit within your current service. When thinking about a research topic, there are some other important considerations that are really useful to think about. Firstly, what data do you need and what data will you need to be able to answer your research questions? Is this something that you already have access to, or will you have to collect some new data as part of your research project? If you are going to be collecting new data, for example, through doing a survey, do you have access to a survey platform you can use to collect this data? Alternatively, if you're planning to do qualitative interviews or focus groups, do you know how you're going to capture this data? Are you going to use dictaphones, or are they going to be online and you can use a recording software on something like Microsoft Teams? You would also normally need some resources to be able to transcribe this data so that you can use it for your analysis. Depending on exactly what you're doing, you may also need ethics approval for your research. We do have another separate presentation that goes into the process of obtaining ethics approval in more detail, so please go and have a look at that if you'd require some more information. It's also really useful to think about the timescales involved. So when will this project happen? Are there any deadlines that you need to consider when planning when to conduct your project? Thinking about all these points will help you choose a research topic and question that is feasible to answer. So you've chosen your topic, but now how do you write your research question? Firstly, a research question should outline the scope and purpose of your research, and a good research question should be clear, focused, and answerable. Research questions are generally structured differently depending on whether you are conducting a qualitative or quantitative piece of research, and I'll give some examples of how these can be structured differently over the next few slides. Quantitative research questions generally include information about the study population, the setting that you're conducting your research in, and define the dependent and independent variables, so the thing you're measuring and the things you're planning on changing in your research. In contrast, qualitative research questions are generally broader and more open-ended. This is because qualitative research generally focuses on understanding people's lived experience of a phenomena of interest. If you'd like to find out more about these methods, we have created other videos in this series with examples of how to do quantitative and qualitative research. Here are some examples of some good quantitative research questions. First question, what is the prevalence of undiagnosed type 2 diabetes among adults aged 40 to 65 in urban primary care settings in England? The second, what socio-demographic or clinical characteristics are associated with the lower quality of life amongst women with breast cancer? And finally, does a digital cognitive behavioural therapy intervention improve depressive symptoms more effectively than standard care amongst adolescents referred to child and adolescent mental health services? You can see here that we've been really specific with the examples of the study population, for example, highlighting that in the first question, we're interested in adults aged 40 to 65. In the second question, this is women with breast cancer. In the third question, this is adolescents referred to child and adolescent mental health services. It's likely that you would then go on to define these topics further when you're planning your research protocol. For example, in the second example, you may want to specify that this is women who've received a diagnosis within the last 5 years. You can also see that we've included examples of dependent and independent variables. For example, for the third research question, the independent variable or thing we're changing is whether people have received digital CBT or not, and the dependent variable, the thing we're measuring, are depressive symptoms. Here you can see some examples of good qualitative research questions, so questions that you might use when conducting interviews or focus groups. Firstly, how do adults with long-term conditions experience self-management support in primary care settings? What are the lived experiences of older adults aged 70 plus adapting to life after a major stroke? Or what are clinicians' perceived barriers and facilitators to delivering trauma-focused psychological therapies in NHS community mental health teams? You can see here that whilst we've still been specific about the population and the setting, these are generally a bit broader, and they're structured in this way because we want to understand people's experiences of receiving support or experiences of having a certain condition. There are a few other helpful frameworks that you can use to help you plan your research project. The PICO framework is relatively well known and is often used within systematic reviews, but it can also be really helpful when planning a research study. PICO stands for Population, Intervention, Comparator and Outcome, and this helps you to specify both the patient or population to be studied, the approach you are testing or exposure to a specific variable of interest, so your intervention, your control group or whoever your comparator will be, and also the outcomes that you're interested in. When thinking of your control group, this could be something as simple as treatment as usual or people on a waiting list. It's only if you are planning on doing something like a randomized control trial where you might want to have an active control group or a group which receives a placebo. When thinking about your outcomes as well, generally it's good practice to specify one outcome as your primary outcome for your research project. So this is the thing that you aim to measure. However, you can also include secondary outcomes too, of other things you're interested in measuring as part of your research project. The FINA framework is another framework that can be really helpful when planning your research. FINA stands for feasibility, interesting, novel, ethical and relevant. And it's really important to take all of these things into consideration when planning your research project. Starting with feasibility, it's really important to make sure that you have enough time to complete your project and thinking about how you can fit this in with your current schedule. Things like gaining ethical approvals or setting up a study can take time, so make sure to factor this in. Secondly, your project needs to be interesting for you and your collaborators to work on. Sometimes doing research can be difficult, and I think if this is interesting, then you'll be more motivated to work on it. As I mentioned in the first slide in this presentation, you should aim to generate new findings or extend previous ones in your research. So your research should be something that's novel, that's not been done before. Your research should be ethical, following relevant ethical guidelines depending on the type of research you're doing. And as I mentioned before, we do have a separate session on ethics, which is really useful if you'd like to find out some more information. And finally, this framework states that research should be relevant and thinking about the impact of your research from the beginning. In terms of impact, what will you do with your findings after you've completed your study? Will they be able to result in any methods to improve patient care or clinical processes within your current local or national setting? And how will you let other people know about the findings from your project? Hopefully this presentation has given you a good overview of how to plan your research project and write a good research question. Here are a couple of references and useful links if you'd like to find out any more information. By following the direct link shown on the screen here, you'll be able to access the catalogue hosted on NHS's Learning Hub platform. Registration is free, and if you have an NHS email address, you'll have free access to both the Learning Hub as a whole and the WE-R NHS catalogue resources. We have links to podcasts, videos, journal articles on a range of topics related to education and workforce research. WE-R NHS is on YouTube, and we also have a regular e-newsletter. Thanks very much for watching.